Welcome to a journey into the world of otosclerosis, a fascinating and sometimes challenging condition affecting the ear. In this video, we'll explore what otosclerosis is, what causes it, how it's diagnosed, and the available treatment options. Join us as we unravel the mysteries of this often overlooked cause of hearing loss. The exact cause of otosclerosis remains somewhat elusive, but we know several factors play a role. Genetics are strongly implicated. If you have a family history of otosclerosis, you're more likely to develop it yourself. Studies suggest certain genes are associated with an increased risk. Hormonal factors also appear to influence the condition, as otosclerosis is more common in women and can worsen during pregnancy. Some research even explores the potential role of viral infections, like measles, in triggering the process. However, the precise interplay of these factors is still being investigated. Otosclerosis at its core is abnormal bone remodeling in the middle ear. Specifically, it affects the stapes, the smallest bone in your body, which plays a critical role in transmitting sound vibrations to the inner ear. In a healthy ear, the stapes vibrates freely, relaying sound. With otosclerosis, abnormal bone growth gradually fixes the stapes in place, preventing it from vibrating normally. This fixation disrupts the sound transmission pathway, leading to a progressive hearing loss. This process typically begins in the area near the oval window, the opening between the middle and inner ear, and can eventually spread to involve the entire stapes footplate. Otosclerosis is estimated to affect approximately 0.% to 0.40% of the population, although the prevalence varies across different ethnicities. It's most common in Caucasians. While it can occur at any age, it typically manifests between the ages of 20 and 40. Women are about twice as likely as men to develop otosclerosis. It's also important to note that many individuals may have otosclerosis without even knowing it, as the hearing loss can be subtle and gradual in the early stages. The most common symptom of otosclerosis is a gradual, progressive hearing loss. This hearing loss is often conductive, meaning that it's caused by a problem with the transmission of sound waves to the inner ear. Individuals with otosclerosis may notice that they have difficulty hearing low-pitched sounds. In some cases, people with otosclerosis report a phenomenon called paracusis willizi, where they hear better in noisy environments than in quiet ones. Tinnitus, or ringing in the ears, is another common symptom. Dizziness and balance problems can also occur, although these are less frequent. Diagnosing otosclerosis typically involves a comprehensive audiological evaluation performed by an audiologist. This evaluation includes a hearing test, known as audiometry, to assess the type and degree of hearing loss. Tympanometry, a test that measures the movement of the eardrum, can also provide valuable information. A key diagnostic finding is the absence of a stapedial reflex, which is a muscle contraction in the middle ear in response to loud sounds. In some cases, imaging studies, such as a CT scan of the temporal bone, may be ordered to visualize the stapes and rule out other potential causes of hearing loss. While otosclerosis is a single disease, there are ways to categorize it based on the extent and location of the abnormal bone growth. For example, otosclerosis can be classified as fenestral, involving the stapes footplate, or retrofenestral, affecting areas beyond the oval window. The Schwarzschild sign, a pinkish hue seen on the eardrum caused by increased vascularity in the promontory, is sometimes used to classify otosclerosis, although it's not always present. Additionally, the severity of hearing loss is used to stage the disease, ranging from mild to profound. Treatment for otosclerosis depends on the severity of the hearing loss and the individual's preferences. For mild hearing loss, a hearing aid may be sufficient to amplify sounds and improve hearing. The most common and effective treatment for more significant hearing loss is a surgical procedure called stapedectomy. In this procedure, the diseased stapes bone is either partially or completely removed and replaced with a prosthesis. This allows sound vibrations to once again reach the inner ear effectively. Another surgical option is stapedotomy, where a small hole is made in the stapes footplate and a prosthesis is inserted. Sodium fluoride has been used to slow the progression of otosclerosis, but its effectiveness is debated. Currently, there's no definitive way to prevent otosclerosis, primarily because the exact cause isn't fully understood. However, individuals with a family history of otosclerosis should be particularly vigilant about monitoring their hearing and seeking prompt medical attention if they notice any signs of hearing loss. Avoiding exposure to loud noises may also be beneficial, although this is more general advice for hearing health rather than a specific preventative measure for otosclerosis. The prognosis for individuals with otosclerosis is generally very good, especially with treatment. Stapedectomy and stapedotomy have a high success rate in restoring hearing. While there's a small risk of complications, such as dizziness, tinnitus, or further hearing loss, these are relatively rare. Research into the genetic basis of otosclerosis continues, with the goal of identifying specific genes that contribute to the disease. This could lead to the development of targeted therapies that prevent or slow the progression of otosclerosis in the future. Studies are also exploring the use of medications that could inhibit abnormal bone remodeling, offering a non-surgical approach to managing the condition. Ultimately, ongoing research holds promise for even better outcomes for individuals with otosclerosis.